Hi there everyone, my name is Prirak Juthani. I'm a first year internal medicine resident at Stanford, and today I want to talk to you about things that are surprising about residency, the good, the bad, and the ugly. And these are things that caught me pretty drastically off guard, and sometimes it was in a good way, and sometimes it was in a bad way. And what I'm going to talk to you about is not necessarily relevant to my particular program. It's actually true about residency across all specialties and across a lot of programs, purely based on me talking to a lot of my colleagues and also just knowing a lot of other residents within Stanford. So with that being said, let's get into it. The first one is the fact that you're literally almost always on the go in residency. Like, have I ever had any activity where the baseline level of stress is just 80 to 100 beats per minute? Like, if you take your heart rate right now, most of you are probably between 60 to 80, but when I'm at work, I am close to 90 to 100 almost the entire time. Part of that is me because I'm an anxious person, but part of it is also when you start residency, you just start realizing the acuity of what you're doing. These are real people, real patients with real problems. And when they have issues, you're the one who has to help fix them. And that's the whole point of being an intern. You're learning the ropes. And so because of that, it can be very scary. Sometimes the analogy I like to give is that it almost feels like I'm juggling 15 plates and not letting any of the plates hit the ground. And the reason for this is because, for example, when you're working during the day, you usually cover anywhere between 8 to 10 patients. And those patients, you are their primary provider in the hospital. So if they need consultants, if they have a new symptom, if they have an acute decompensation event, you are the first one who has to figure out what's going on. And when you're doing that for 8 to 10 patients, that can start becoming a lot because you might be getting a notification about one patient and then another patient acutely decompensates, and you have to figure out a lot of those things. And that juggling can be very stressful at times. And especially when you're working those long hours, it can really get to you. The good part is, as you start learning the ropes, you're going to slowly start feeling more and more okay with these responsibilities. But it still doesn't change the fact that these are very, very tough responsibilities. The second thing I'll also say is sometimes overnight, you cover more patients. So when I'm at night, I cover anywhere between 30 to 50 patients. And that's because during the nighttime, most people are sleeping. The only thing you have to do is kind of acutely stabilize anyone who acutely decompensates. And that may seem easy, but sometimes it can be really tough. And so because of that, you're literally always on the go. And that to me has been like a huge, huge shock, because I think in medical school it's tough, but it's tough in a different way. It's intellectually tough. Now it's a little bit more like taxing, it's demanding, life gets in the way. And so that's the first truth of residency. The second truth of residency is a little bit on the brighter end. The realization I made is that it's on you to help and advocate for patients. As I said, you are the primary person taking care of these patients in the hospital. So even if you're a surgical intern, if you're an internal medicine intern, if you're a derm intern, whatever it is, when a patient is on your service, you are taking ownership of that patient. Whatever their issues are, if they have a new symptom, it's on you to say, okay, how much do we want to work this up? What do I need to work this up? Is there something I don't know about this patient that maybe I should know? And if that is the case, then you also have to ask for help. The help can be in a lot of ways. You can ask your senior residents. You can ask if a patient maybe has a cardiac issue and you're worried, you reach out to cardiology, right? So it's on you to ask for help, and it's also on you to advocate for the patients. You're the one who knows them the best. And what that also means is when you don't know what's going on, you have to know the right people to reach out to, because those people will be the ones who can help you in your time of need. And that was a little surprising to me too, because there were so many times I didn't know what was going on and I felt really crappy about it. I was like, I should know this. But actually what I should know is know who to ask. And I've slowly now started learning that. Like, I don't know this, but I know who I can ask to help me learn this. And the next time maybe I'll know it a little bit better. So that's the second thing I realized. But you still have to take ownership over that. Know when you don't know something, know when to ask for help, and know when a patient seems a little bit off. Like maybe the patient looks a bit more sick. You know the patient well, so advocate for them. Say like, hey, this patient, even though they look good, I don't think they look as good as they did yesterday, and I want to make sure we keep an eye on them. Now, the third surprising thing about residency, this is the second to last one, is the fact that learning the system is just as hard as learning the medicine. You may think that residency is all about hey, you have to know how to work up angina. You have to know how to work up left lower extremity swelling. You have to know how to work up non-pitting edema. You have to know how to work up appendicitis. All of those things are true, and those are things you're definitely going to learn while you're in residency. But the other part that you have to also learn, and I think is particularly way more stressful in your first year, is the entire system. For example, how do I reach out to the nurse of the patient? If the patient has family, how do I contact them? If the patient lives in a certain place, how do I know what that place is like? What kind of social determinants of health do they have? If that patient acutely decompensates and they need a consult, how do I call that consult? That entire framework is called the system of medicine. And I think that framework was very different from the science of medicine, which is knowing how to work someone up when they come in with symptoms. Sure, it's great that you can actually tell a patient, hey, you have heart failure, and here's how we're going to treat it. But it's also important to know, hey, once you're discharged from the hospital, who's going to follow up with you? How do I make sure you do have good follow-up? How do I make sure you get the medications you need? What's your pharmacy? And you're going to be prescribing to that pharmacy. Do you know how to get to that pharmacy? You have to ask the patient these things. And so that systems level thinking is not nearly as emphasized in medical school, but it's just as important for you to know it because it's a big part of your job, right? You can provide exceptional care for the patient in the hospital, but if you have no idea how the patient is going to follow up outpatient, you have no idea if they're going to take their meds at home, you have no idea if they have someone who can help them take their meds, and you have no idea if they even have a cardiologist or a PCP, then most of your effort may get ruined. And that's why knowing the system is really good. Does your program have a way for this patient to be seen by someone else on an outpatient setting? So that way when you do work in the inpatient, it actually translates to better outcomes on the outside, right? So that's the third surprising part about residency. I thought it was all about, okay, I just need to know how to work up patient care, which is a big part of it. But no, you also need to know how to work up outside stuff. How do I integrate this patient's recent hospitalization with their current framework, their current community, and ensure we avoid a hospitalization down the road? It's optimistic, it's challenging, but trust me, it's a big part of the job. And last but not least, the last residency truth is, this is really pessimistic, but if you think it can't get any worse, you're wrong. And I mean this in a lot of ways. Residency is so much about learning how to be comfortable being uncomfortable. And there are multiple times where I'm like, this day is such a disaster. I feel really scared and there's no way it could possibly get worse. And it does. Because guess what? There is sometimes no predictable way to know when people are going to suffer. You may have a patient who has a pulmonary embolism and then one of your other patients may code. And for that reason, it is so important in residency to have contingency planning. And at my program, we like to call these the if-then statements. You should always have them in your head. If the patient spikes a fever, what are we going to do? If the patient acutely gets hypoxic, what are we going to do? If the patient codes, what is their code status? Are we going to do chest compressions? Are we going to shock them? Is that all things that they would want? These are all contingency statements because in the hospital, you have to prepare for anything and everything. And we try to do that to the best of our ability. But if you don't do that, that's when things can really hit the fan and get bad really fast. And that's what I mean by if you think it can't get any worse, you're wrong. But at the same time, this is often also where you will grow the most. When you have 80 emergencies and you have to figure out which one is the most important, you're also going to learn that, okay, here's how I triage. When you have 5 different things going on and someone asks you about something that can easily be done in a few hours, you are like, okay, this is not important right now. Right now I'm going to figure out this patient who's acutely unstable. And you address that. And you learn these skills. But part of these skills are learned once you acknowledge the fact that, hey, things can go very, very wrong, very, very fast, and you have to be ready for them. So hopefully this was very insightful for you. These were the things that really surprised me about residency, and I wish I had known about them. Hopefully they help you, and in the process, make you a better healthcare provider, and ultimately make you happy. So thank you all for watching this video. If you did like it, drop a like, comment, share, subscribe, and I'll see you all in the next one. Peace.